point of view. This is the smile with a more close look, and this is the digital smile design project. Very easy and very predictable stuff. The face from side and the intraoral pictures with a close look to the problem. The right center incisor has a big decay, and the left one is restored with a composite resin restoration. Pictures from different side. Also, there is caries decays on the lateral incisors. Now you can see this. And the close look to this, I call this like a black hole. It's a joke for sure, but this is a caries decay that gives us a lot of problems during the preparation, during the isolation, and during the restoration. You will see the case step by step. The view from the palatal side, you can see old restorations on the palatal from of both teeth, and also some caries decays and lesions from lateral incisors. The different angle, the X-ray before endodontic treatment with some apical periodontitis on both teeth. This is the image with a polarized filter to be able to give color information to my dental technician, because this case will be managed in an indirect restorative way. We are going to create metal-free ceramic restorations. And again, even in in a case where we need endodontic treatment, I'm starting with prep to be able to know the information about the restorability of the tooth before I will start endo. This is the marking preparation. This is a 1 mm cut of the incisal margin and the marking lines on a vestibular side. How it was on images. Close look and a different angle, and then other steps for crown preparation, like a separation and the creation of the main amount of cut.
Da minha frente que eu quero passar, pois o samba está animado, o que eu quero é sambar. Este samba que é misto de maracatu, é samba de preto velho, samba de preto tu. Mas que nada, um samba como esse tão legal, você não vai querer que eu chegue no final.
Some images, and now you can see a real problem from the mesial aspect of this tooth from periodontal point of view, and also from the isolation point of view as well. We offered to the patient for a crown lengthening procedure, but the patient was afraid of any surgical treatment and asked us to avoid all stuff with scalpels, blades, and something like this. So we had to do our treatment in a so-called more conservative way, but the problem was not only a restorative part, but periodontal as well, as I mentioned, and the isolation as well. To be able to isolate this kind of stuff, we need special clamps and the heavy rubber dam for sure. I place my clamps on, this is 2.0 clamps by KSK. And now, to help me to secure the margin, especially in a missile part of this incisor, we will use the Teflon tape, and now we can see it on a video.
We'll build a fortress to keep them out, and in a world gone silent, I'll be your sound.
Okay, how it was. Now the margin is perfect. I can observe it for 100% and be safe during the irrigation procedures. Now the endo part, nothing special for endodontists. To remove the old obturation materials using the ultrasonic. Maybe some tricks with a assistant. I asked my assistant to read during the ultrasonic tips usage to be more efficient and to have more clean surface.
Run into a new day, and through it all, I'm on your side now.
Provides irrigation using the sodium chloride. During I use my ultrasonic file to remove the obturation material inside of it. Very time-saving procedure.
We'll build a fortress to keep them out, and in a world gone silent, I'll be your sound. And if they try to hurt you, I'll tear them down.
Some pictures from the obturation sequence. All is clean, core build-ups, and the preparation. I pay your attention to the mesial part of the central incisor. You can see a real deep margin, and this deep margin was secured and prepped to the tooth being isolated. How it was, we will see on the video. This is a regular spatula, helps me to protect the rubber lamp during the invasive prep, basically from the speed point of view. But again, this is the electric handpiece with the red stripe work. Now you can see that I provide the prep without any special protection. Rubber lamp is great for securing the lamp. Nice tension and spongy. This is the view to the margin. A real mixed fight case, as I call this stuff, like an endo-restorative full range from endodontic to restoration, from the planning to realization of the treatment planning. This is the second appointment during which I was going to provide the treatment for lateral incisors. And there is one more trick with clamps, because these clamps, one